Hi everyone, my name is Dr. Jemima Karaki. I promised to do a video on breastfeeding for the Global Breastfeeding Week. But I thought to do something better and to get someone who does this professionally. And therefore, I got one of the best midwives that I know. So she's a midwife, she's a lactation counselor, and she's a Lama's and child educator. So I'll let her come in so that she can give us some breastfeeding tips, as well as the do's and don'ts, and any tips on increasing your milk and such things. So yeah, stay tuned. Action.
Hi dog, hi people. I am Asha Kagendo Kaberia. I'm a midwife, I'm a lactation counselor, I'm also a mass childbirth educator, and thank you for having me talk about this very important topic about breastfeeding. Yes, it's a very
Yeah, I know it's an important topic for you. I really know that. So tell me, if someone is pregnant and trying to get ready for a new baby and all those things, what would you advise them concerning breastfeeding?
Actually, I think it's very important for any mother before they give birth to at least have a chat maybe with their healthcare provider or midwife, whoever is at the clinic, or even better, a lactation counselor, and get to know at least what to expect during birth and after birth of the baby in terms of their expectations during lactation. Usually, I find it easier when you know what is expected of you. It comes more naturally. You're able to cooperate. For example, we advise that you need to breastfeed your baby within the first 30 to an hour. So probably you just given birth and then you're given your baby and someone is trying to fix them on the breast and you're like, why? I need time to rest. But you see, if you had this explained earlier, then you're more receptive to it. You know the importance of having your baby latch immediately, put your baby on the breast immediately after birth, the importance of the baby getting the very first milk, which we call the colostrum, the bonding that comes immediately after the baby is born. You see, they cope better when with life outside the uterus, when they're put to bond with you immediately and look for the breast. They're actually born knowing this and prefer it as soon as possible. The baby to breastfeed together warm, and they actually tend to cry less if you breastfeed your baby as soon as possible.
All right, thanks, Asha. So now, what happens if I have had a CS, for example, and I may not be able to get to breastfeed within the first 30 minutes? What happens then?
Yeah, sometimes it can happen that you were not able to go through the normal delivery and had probably to go for an emergency CS. What we say, yes, after the surgery you have some time to recover, probably an hour or so, but still you have a window of like 8 hours whereby the baby does not need anything other than your breast milk. So what you need to do is just let your nurse know that you still would like to breastfeed your baby as soon as possible, as soon as you're stable, as soon as you're settled in the ward, and request for them to at least assist to put the baby on the breast. The baby does not need so much of your milk and so much of your time, probably not really important. They just need
Yes, yes, yes.
Yes. What I tell mothers is breastfeeding is a skill. You need to learn it. And as you're learning, your baby is also learning it. So be patient with yourself, with your baby. It takes like almost 6 weeks for you to perfect this art. So of course, along the way, there will be challenges, and sometimes you even doubt if you're going to do this, but you keep going. You keep going. Every day you learn your baby, and your baby also tells you the best positions that to breastfeeding. But first things first is for yourself. You need to take care of yourself.
Thank you. So, is there something I can eat so that I increase my milk, or how does one go about that?
Definitely, we begin with a balanced diet. Have your normal balanced diet, and on top of that, more fluids, and fluids can be anything. And to include water, water like is enough. If you take lots of water, is enough to bring your milk, to allow your milk like that. Definitely there are foods that are believed to bring food. I will not disregard that as well. You can, whatever works, please just remember a balanced diet and no foods.